Welcome back from our break, and we still have our guest in our midst, in the person of Senator Hillary, the SUG Director of Health, 7th Assembly. Welcome again, sir.
Thank you.
Okay, moving on to our next question. There are some female who, okay, they're no longer a virgin, but in the process of having sex, they start bleeding. What could be the cause, and why does it happen?
If I'm to get your question right, you said this person has been sexually active
Yes, yes,
and then
yes.
all of a sudden had sex and started bleeding.
Bleeding.
So many things may be involved. Many things may be involved. It may be a rough or a painful penetration. It may be disease related and all that. So, but then it's not normal and it's not a proof of virginity. So, once someone experiences such, the person should seek medical aid immediately. Yes.
So, what do you have to say about irregular menstruation?
Irreg-
But yes, like for example, a girl will see her period this month, next month she won't see her period, or for the next 2 months she won't see her period.
As far as I know, it is not normal
Mm.
and it can also be a byproduct of some disease conditions or stress and hormonal imbalance. You know, there are this amount of stress that a lady would be exposed to in a particular month that can hinder her monthly visitor from coming when it is supposed to come. And I think it's scientifically proven as well. So stress can also cause that, and hormonal imbalance as well as disease conditions. You understand?
Okay.
Like some of these STIs, one of the signs and symptoms is actually um, irregular menstruation. You understand?
Mm. All right, sir. So, moving on to personal life. What do you do for fun? Except from visiting the mortuary, going to the clinic, SUG work, school work, what do you do for fun?
I am a choir master, so I'm a Catholic choir master, yes, and I'm a very ferociously reader. I read a lot,
Okay.
and I watch football.
You watch football.
Yes,
So, what's your favorite club?
I'm a Chelsea fan.
So, Nana, give five,
Southampton, yes,
five, 5-1. It's not
yes,
easy. It's not easy. It's not easy. Okay. So, do you bring religion into your field, your medical field?
of course, of course, of course. I bring it into my medical field because my belief does not support some modern practices.
Okay.
You understand? Like I'm a Catholic, and in Catholic we are against artificial fertility. You understand? The
Okay.
Catholic, the Catholic faith and doctrine is against IVFs and the likes of it. So that automatically drew the borderline and meant that
So you
I
won't
could not
involve yourself
go
with it.
into embryology and fertility, artificial fertility. I had to leave the field. You understand? Because of that. And secondly, again, as you know, the church has a very, very firm stand on abortion.
Okay.
So you see that use of contraceptives and abortion is in the Catholic Church. We say it is a mortal sin. You understand? So such things actually guide my path in the medical field and practices.
Okay.
Yes,
So do you have a girlfriend?
yes, I do.
Okay. So if your girlfriend, okay, you're engaging in sexual intercourse with her, and she gets pregnant when you are not ready, what will you do to the baby?
First of all, first of all, I would say I will stop imagining. If I would say I will stop imagining because I believe I'm old enough to think on my feet. You
Okay.
understand? And to prevent such eventualities. You understand? Now, should it happen, I should take responsibility.
Whether ready or not.
Whether ready or not, I should take responsibility because, okay, it has happened, is that it has happened. And I hate to say this, but that my son might just be the next president. You never can tell. Why should I kill it? Mhm.
Okay.
Yes.
So, what advice do you have for the youth out there? Not only in AE-FUNAI, but the youth out there who wants to take a course in anatomy, who is sexually active and who is suffering from one diseases. So, what do you have to tell them? What do you have for them?
Okay. First of all, students who are out there who want to study anatomy,
Yes.
I will tell you that I can't remember the place in the Bible actually, but there's a place in the Bible that says that whatever your hands finds to do, do it very well. If you decide to study anatomy, please don't be an average anatomist because the world is fast, fastly moving beyond mediocrity. So if you're a mediocre, you don't have any place in the world of medicine, most especially anatomy. Why? Because most doctors actually know anatomy more than the people that studied anatomy. Why?
Okay.
Because most doctors dedicate much time to studying anatomy than the people that study
Studied
anatomy.
anatomy.
So if you must match the doctors in the field of anatomy, you must be outstanding. You understand? That is why you see people say that doctors are taking up everything in the medical field. That is because in actual sense, in terms of value, in terms of competence, and in terms of knowledge, you still see doctors leading because of how much work and how much time they have put into, have invested into study. You understand? Then for the second category of people who are sexually active, please and please stay safe, play safe, and as much as possible, it is no flex that you have slept with 20 girls. It is no flex that you have slept with 50 men. There is pride in fidelity and there is pride in abstinence. Choose one partner, remain true to the partner while the partner does the same for you. You understand? You
Okay.
get to know the partner gets to know you, and that is all that matters. You know, there was one book I read. It says that the problem men have is that we try to understand the women. You don't need to understand women. You just need to understand your partner. You understand? And that is the same with sexual activity and performance. You don't need the whole world. You just need to understand and to satisfy your partner, and that is it. And finally, for people who have sexually transmitted infections, seek help. Seek help. Seek help. For the third time, seek help. Why? Because I was privileged to do my industrial training at a medical facility where we are actually exposed more to these sexually transmitted
Is it?
infections. And you actually see that most of the time, their cure is very, very minimal. It's just the identification. But because of the way that we are secretive and we like hiding things to ourselves, girls most especially. You see, so many girls they live with urinary tract infections. You see, so many girls they live with sexually transmitted infections, and most times they are not reactive to them. It is only when they now go in contact or have sexual intercourse with a male counterpart that the male counterpart starts getting the signs and symptoms. You understand? We say that it is asymptomatic in female, but symptomatic in male. So, as much as possible, seek help. You don't have to be afraid or ashamed of anything. Your life first, and your life is priority.
But most medical practitioners make them feel that, or how will I put the word? Make them like they make them feel ashamed that most girls they can't speak up because they'll be like, oh, that guy have infection or something like that. So most medical practitioners make them feel less of themselves. So they intend to hide it.
I do not think so. Like I said earlier, there is doctor patient confidentiality,
Okay.
and everything you tell a doctor in the consulting room remains between you and the doctor. In during the induction of doctors to the Nigerian Medical and Dental Association, they take an oath. One of the things that are included in that oath which they take is an oath to confidentiality and secrecy, which means that except what you have told them is a vital information regarding to you and will save your life, they are not under any circumstances permitted to disclose that information. If they do, you can sue them and they will lose their license. You understand? It is they call it the Socratic oath. Yes, Socratic oath. So about about whether what you told Dr. A or what you told consultant B will remain secret. Yes. Even if it does not, the most important thing is that you are well. The most important thing is that you are well and you are healthy. Then we can now talk about whether it remains secret or not.
So, what are the safety measures to take during gathering or GST or during sports in AE-FUNAI?
Okay. You are asking what measures we are going to
Yes.
take to prevent casualties in
Mm-hmm.
such occasion. This is a very good question because this is one of the litmus that will test how prepared my directorate and I are towards tackling some of these prevalent issues. Now, we're going to take it by two steps, or rather three steps. Number one is by putting preventive measures in place. Number two is by educating and orientating the students. And number three, beg your pardon, is by cooperating and working together with the management. You understand? My regime would work with the management for the students.
Okay.
You understand? Now, in terms of putting preventive measures in place, by January, I would write to the president of the assembly to approve training of the AE-FUNAI sports medical team. And then once the sports medical team has been trained, the sports medical team will be trained on first aid, they'll be trained on CPR, resuscitation of students or anybody before taking the person to the hospital or to the clinic, as the case may be. And finally, every other medical knowledge that would be beneficial to them, they'll be trained. And once this is being done, no sporting activity would go on, most especially football, would go on in that field without the presence of a sports medical team. You understand?
Okay.
This is something I will do hand in hand with the director of sports, and we will see that this is achieved because when something happens to you, I will be held accountable. You understand? I
Yes.
knew how the previous director of health was dragged mercilessly because of the issue that claimed the life of the
Student.
economic guy, and that has been it. That has been it. We will put in preventive measures. You cannot have a gathering of about 200 or more students within the university environment. And I will not write to the university management, please provide ambulances for these places just in case of eventualities. Just in case of eventualities. Ambulances, like on the day of match week now, I will write to the management, please provide ambulance at temp site, provide ambulance at PEM site, the barest minimum, so that if something happens, we can reach the student immediately. You understand?
Yes.
And then we'll also work, well, we are working as well. We are working already on creating an emergency response team, whereby we're working with the hostel porters, we work with the lodge presidents, and work with religious leaders, so that when something happens immediately, you are 2 phone calls away from
Okay.
getting help. Now, when you talk about educating the students, you will need to make them to understand that you don't need to rush for the line. You don't need, because no matter how hard you want to see this, students are often the architects
Yes.
of their own disaster.
Yes. We
If
want to write first.
you don't need to rush for the line, just stay. If we are in an organized form, we are most likely going to avoid casualties and stampede. This is very, very necessary. It's not even that, and this is actually a dry season, so you see dust everywhere.
Uh-huh.
So when you rush, you are endangering people with respiratory problems like asthma.
Asthma.
You understand? So they need to be educated that you can write this in an organized way, in an orderly manner. We came to school to learn academics and also learn character. That is why at the end of your stay in this school, you'll be given a certificate in character and then learning. So we must also imbibe in ourselves orderliness. So when you tell them you can actually do this, you don't have to jump the line. Don't worry. If it is ordered, it will go fast. If you don't finish today, tomorrow will continue. But we must stick to the normal route. You understand? Then finally is that we work with the management in collaboration with the director of academic planning. We meet the management. Please split these GSTs into days. It doesn't matter if they are writing it 1 week. Okay, the exams are started already. This on Monday, Faculty of Agric will write their own GST. You know that the only people writing GST on Monday is
It's
Faculty of
Faculty of
Agric.
Agric.
It's going to reduce this unnecessary quagmire.
Yes.
It's going to reduce it to the barest minimum, because the only people permitted to be in that complex at that day is only students from the Faculty of
Agric.
Agric. Tuesday, Humanities, Wednesday. Even if it takes 1 month, as long as it is organized, as long as it is done in such a way that it reduces casualty for the student communities, we are, there is one aspect that we are actually overlooking. It is the science labs.
Yes.
The science labs, the physics, the chemistry, and the biology labs, where you have 3,000 students or more inside
One particular room.
inside the hall.
Small.
Inside the hall. And I will not tell you on hearsay. In my 100 level, I witnessed 3 students fainting during
Practical.
practicals. Now I wonder, what if by mistake fire starts in that lab? Are there fire extinguishers? Is it working?
Is it working?
So you see, these are the preventive measures that we will ensure that they are put in place. Our school is always beautiful when there is accreditation. Our school is very, very beautiful when there is accreditation. And in actual sense, I believe that our school can be beautiful with or without accreditation. So these are the steps that we will take to tackle this issue, because it is very, very, very important. It is very, very important. So that's that.
Okay, sir. Thanks very much for the assurance and the advice I've given to the students and the youth out there. We're very happy and thankful. It's an honor to meet you in person and to host you here as our guest. We want to see you more often, and please, we encourage you guys to listen to whatever is said. And remember, follow the safety measures.
AE-FUNAI Tori with Humphrey.